Good morning, everyone. Well, it's 11:36 here, so it's still morning. Uh, and I'm getting over sickness, but it doesn't look like it's COVID. Just seems like a very, very bad head cold. You can probably hear it in my voice. So I don't know if this will be the best lecture, but we'll get through it. There is a review slide for the material that we went over last class. I won't go over this, but you can sort of test yourself on that. I want to get right into discussing psychopathy, and usually in class I'll ask for some classic psychopaths from film and TV, and usually people mention characters that sort of do meet our criteria for a psychopath, but others don't. But here are a few that actually do. So Anthony Hopkins' portrayal of Hannibal Lecter in Silence of the Lambs, and then we have Heath Ledger as the Joker in Batman. I forget which Batman film there is. That was there's so many. Was that The Dark Knight? I think it was The Dark Knight. And then you have Voldemort, of course, played by Ray Fine. And these are all sort of classic psychopaths from film and TV. And so there are two questions here, right? What makes these characters psychopaths, right? So we'll talk about how we define psychopathy, and then we'll talk about how we measure psychopathy, and then we'll talk about sort of the biological correlates or underpinnings of psychopathy. Then I usually like to have a little bit of discussion about whether there are people like these characters in real life. Do people like this exist in our reality on Earth? We'll talk about that, and we'll talk about sort of the percentage of criminals that actually meet the categorical criteria to be a psychopath. So how do we define psychopathy? So four traits compose the psychopathy factor. And again, I usually like to, in class, sort of ask what people think make up, what traits make up psychopathy, what sort of traits make up psychopathy. Four traits do. So we have, I'll just put them all on screen all at once. So we have sort of the first factor. Actually, I'm gonna change that because these are technically factors. I think I always mention that, and I always forget to change it. All right, so we have four factors that compose psychopathy. I know that should be traits, because sorry, my head is really stuffed right now. But no, yeah. So psychopathy is the factor. These are the traits that compose psychopathy. All right. So the first trait is manipulativeness. So this is sort of the interpersonal dimension to psychopathy. And usually I ask what it means to be manipulative. And so this is different than when we're talking about the criteria for a true experiment, where we have a manipulated IV and random assignment. Here we're talking about sort of the trait of being manipulative, and usually this is used in a negative way, right? That people are trying to change other people's behavior for their own benefit, right? The second trait here is callousness. This sort of makes sense if you know what a callus is. So a callus is usually a hardened piece of skin on your body. And so that's where the term sort of comes from. So it means to lack empathy. Third is the sort of lifestyle dimension here, which includes impulsivity and sensation seeking. So there tends to be this element of risk taking and rule breaking, or I should say rule breaking, that's more antisocial. So sorry. So sort of risk taking behavior, so being impulsive, taking risks. And then fourth is sort of the antisocial dimension here. This is the rule breaking dimension here. So this can include delinquency, criminality. And so a lot of times when I ask people to think about what is psychopathy, a lot of people mention sadism, which is harming others just for the mere pleasure of it, is not part of psychopathy per se. And so tends to be a little bit of a debate in the literature here. Sadism and psychopathy are positively correlated, but not enough so that sadism becomes part of psychopathy. So it's not that, people who score higher in psychopathy cannot be sadistic. There tends to be a positive correlation there, but not so strongly that sadism can be included as part of psychopathy. And then a lot of people get confused about psychopathy versus sociopathy. And a lot of people think of, when I ask for classic psychopaths in film and TV, a lot of people think about sociopaths. And so someone like Dexter, if you've watched Dexter, is that on Showtime? I think it's on Showtime. Dexter is more of a sociopath. Dexter does lack empathy. He's a planner, though. He likes to plan. Definitely antisocial. But he lacks that manipulativeness. He's not very savvy around people, if you've watched the series. So sociopaths usually include two through four, but don't have that interpersonal factor here. Don't lack that charm to manipulate others. So how do we measure psychopathy? So it depends on what population that you're actually working with. So if you're working with a clinical sample, so this means that people are actually seeking help via hospital or criminal populations, someone that is institutionalized. Sorry for the timer going off in the back. You want to use the Hare Psychopathy Checklist Revised. So Hare is a huge figure in the psychopathy literature, and he mainly looks at it from a very clinical perspective here. And if you're working with a subclinical sample, so subclinical is sort of the best term to use here, because some people say like normal versus clinical samples, and we don't want to say normal. There's some bias in using the term normal. What is normal? So we say sort of subclinical. So if you're working with a clinical sample, this is administered by a trained clinician, usually a clinical psychologist with a PhD. And the clinician works with various sources of data. If we think about back to the Sybil Pin sort of the Sybil Pin method of extracting data from people, the clinician uses self-report data, archival data, interview data, um, uh, um, to make a categorical decision about whether someone can be considered a sort of quote-unquote psychopath categorically. And so about 15 to 25% of people in clinical samples, this again includes people that are institutionalized as well as criminal populations, about 15 to 25% can be categorized as psychopaths, and that equals to about 1% of the general population. So the self-report measure of psychopathy for subclinical samples, it's a self-report measure, solely a self-report measure, and we'll take a look at it on the next page, the next slide. There's no categorization criteria, so you cannot use the scores here, the self-report scores, to make categorizations about people, about whether they're psychopaths or non-psychopaths. So to sort of put it in sort of a graphical representation here, if we measure psychopathy among a representative population, we will get a normal distribution of scores. And it's really the 1% here, the 1% of the general population that is categorized as psychopaths, right? So among the entire population, we're only talking about the 1% in the very extreme right-hand upper part of the distribution. And so these are the people that we think about when we think about classic psychopaths from TV and film. These it's the 1%, but a different 1% here, the 1%. And we'll actually take a look at some participants' scores from some different types of samples here in a second. And so I know this can be a little bit hard to read, but if you download the slides from Canvas, you can read this a little bit better on your own screen. But I've included the latest psychopathy scale that includes about 8 items per trait. So we have callous affect, the erratic lifestyle, interpersonal manipulation, and then criminal tendencies or rule-breaking tendencies. So you can feel free to take this by yourself, or hand it out to friends as a Christmas gift. See where they score. But yeah, so just including that as a reference here. So here are some scores from different samples. So we have 3 different samples here. So we have criminal offenders from Wisconsin, and so the offenders are all male here because usually criminal offenders tend to be vast majority of them male. And then we have college students from a couple of institutions in the U.S., and then we have a community sample here. And so sample sizes range from about 300 to 1,500, so some big samples here. And so this is usually a fun little exercise I usually do in class, where I ask people to guess how college students score comparatively to the criminal offenders and the community sample. Because you can see the criminal offenders, right, are scoring meaningfully higher than the community samples, but it's a question of where are the college students going to fall here? And so if we take a look at the college student scores and then put up the differences, so here, oh yeah, I should also explain, so we have the interpersonal manipulation trait, callous affect, erratic lifestyle, and then we have antisocial behavior. So we have the 4 traits here that compose psychopathy, and then we also have an overall psychopathy score. So for interpersonal manipulation, for example, we see that college students score in the middle. So 2.38, so they're 0.58 points lower than the criminal offenders, but actually 0.44 points above the community sample. As you can see, college students generally score towards the middle here. But we see probably the biggest jump, the biggest difference here for the antisocial behavior. So we go from 1.25 up 3.31 points, and then we go up 1.44 points. And so this is a huge leap here. So we find the biggest difference between college students and criminal offenders for antisocial behavior, that rule breaking. But this is just, it goes to show that we do get variability when we get different types of samples. And it's not like people either are psychopaths or aren't psychopaths if we consider a representative sample, that we get a normal distribution of scores. And again, only 15 to 25% of people who are in clinical samples actually can be categorized as psychopaths. So how may psychopathy be hardwired in the brain? So we're going to talk about activity in the prefrontal cortex, limbic system, brainstem, talk a little bit about neurotransmission, and then also talk about how heritable the different traits for psychopathy are. So first, prefrontal cortex. Looking at the research, you can probably guess whether people who score higher on psychopathy have greater or lower activity in the prefrontal cortex. Again, you think back to antisocial behavior, impulsivity, risk-taking, lacking empathy. But at the same time, you may think about the interpersonal manipulation, right? And interpersonal manipulation requires some level of perspective taking, right? That you can, sort of read other people and read how to manipulate them. So you may think, oh, maybe there's greater activity in the prefrontal cortex. But the other sort of three traits here, the lack of empathy, impulsivity, and antisocial behavior, sort of outweigh anything else that's happening. So generally we find lower activity in the prefrontal cortex, and this is, regardless if you look at how big or small the cortex is, or you look at activity in the moment, using fMRI or PET scan, usually we have lower activity in the prefrontal cortex. So I'm going to put up the next three together because I'm gonna tell a little story here. So we generally find in the limbic system we have lower activity for fearful stimuli. And the amygdala, we have lower cortisol levels in response to fearful stimuli. And we also have lower general arousal to violent or fearful stimuli. So meaning, lower heart rate, lower blood pressure, lower breathing. And I think this makes sense if you think about a time in your life where you've done something bad. And so I like to talk about, like maybe when you were a kid and you finished dinner and you had a cookie for dessert, and you brush your teeth and you're in bed, and you want another cookie, right? And so you're picturing, like how good that you're thinking about how good that cookie will be. And so you're like, all right, so I you start to formulate a plan, right? You're like, okay, I'm gonna wait until I hear my parents' bedroom door close. I'm gonna wait until I hear the TV go off, and then I'm gonna sneak down and get that other cookie, right? So you're planning this out, and maybe you open the door, you don't hear anything, and then you start walking down the hallway and then down the stairs, and then you forget about the creaky stair, and so you hit the creaky stair, or maybe you knock something over, right? And then what happens when you think that you may have alerted your parents, right? You start to sort of freak out, right? Your probably cortisol levels go up, your heart rate and breathing and blood pressure increase, your probably amygdala gets active because you're scared of what would happen if your parents caught you, right? And so for people who score higher on psychopathy, or people that are categorized in psychopaths, they don't have that sort of more, I don't want to say normal, but normalized reaction to being caught. And then we also see that for people who score higher in psychopathy, we see that the reward center is more active in anticipating rewards. So if you're expecting to get something really really awesome, for people who score higher in psychopathy, their reward center gets more active in anticipating rewards. Would it be praise, money, whatever, power? But at the same time, they don't have as many dopamine receptors in the limbic system. So remember, we find that the greatest dopamine activity occurs in the limbic system, with some pathways to the prefrontal cortex. And because they don't have as many dopamine receptors, they don't feel as satisfied when getting that reward, right? Because dopamine, floods your brain, and after achieving a certain reward. And it's not that people who score high in psychopathy don't have as much dopamine, but they lack the receptors to process that dopamine. This is referred to as reward deficiency. So we find with people who score higher in psychopathy, maybe we see that impulsivity or sensation seeking or risk taking, because they sort of want that high, and it usually takes more and more. It takes riskier activities in order to feel that sort of dopamine rush. And that's part of why we see greater delinquency, criminal behavior, risk taking behavior. And that could also include taking illegal substances as well. And then finally, if you look at the heritability for psychopathy, we find that the heritability coefficients range from 0.46 to 0.7. So about 46 to 70% of the differences in psychopathy tend to be due to genes and not the environment. So there is a strong genetic component to psychopathy here. So ultimately, we come full circle here, and we talked about Charlie, the Virginia school teacher, and people generally tend to be more lenient to Charlie. People think about his case differently than others because he had that tumor, grow on his prefrontal cortex. He had no history of criminality or impulsivity. He, was leading a normal life with his family and stepdaughter. And so if we give Charlie a break, then do we also give people who are born with these, sort of neurological differences or neurological deficiencies, do we also give these people a break? That these people may have been born this way. So do we take a different tact in treating, criminals? Do we focus more on rehabilitation and maybe especially neurological rehabilitation? Do we think about doing something like TMS, right? In trying to sort of treat these criminals, right? Because once they get caught, they're punished, but what do we do once they're out, right? We don't want them to um, uh, re-engage in criminal behavior. We want low recidivism rates, right? We don't want criminals reoffending. Right? So this is just things to think about as you get older and move forward and have to make these sorts of decisions in your life or um, in voting for legislation or sitting on juries. You want to consider all these aspects. But anyways, that's it. I was going to try to keep this at 20 minutes. We're at 21, so I consider that a success. So take care, guys, and I will see you next week.